Well, so let me share with you all my today's topic. My topic is Insidious Depression, a Neurocognitive Perspective. Now, first of all, as you can see in the picture, I would like to mention that the word depression is known to everyone. Depression occurs when our mind becomes overloaded with lots of thoughts, lots of emotional distresses. And there are no so-called specific biological markers, there are no specific blood tests which can show that we are a diseased person. So it's a slow erosion of our own self, as insidious as many other disorders like cancer. So it's a type of solitary experience. And I would say that if you have an absence of ease, that's a disease. If you have absence of expression, that's depression. So let me start clearly to the topic of depression. Now, depression is a leading cause of disability worldwide. So it's considered a major contributor to overall global burden of disease. Depression is a multifaceted, pervasive, persistent, insidious disorder, nearly as complex as our brain itself. The interesting fact, as has been mentioned by WHO, it's a data from WHO, that more than 264 million people of all ages, irrespective of gender, irrespective of caste and creed, suffer from depression. And more women, it's very interesting, more women rather than men are prone to depression. Now, I had a data from the Lancet journal, the very well-known journal, in 2018. It was published that in 2008, it was WHO who ranked major depression as the third cause of burden of disease worldwide, and projected that the disease will rank first by 2030. And I'm afraid that due to the pandemic situation of this COVID-19, this depression is soon to be ranked as first by 2020 rather than 2030. Now, it's very interesting to find out the different types of models which came up in case of this psychological or neurocognitive perspective. Now, we used to have a traditional model of disease development. That means if we have disease, that means there's something called infectious agent or a pathogen behind it. We should be able to cure ourselves through medications, through different lifestyle modifications, so decreasing the susceptibility to those pathogens. So that was the disease or pathological aspect of the traditional model. Now, with the development of our neurocognitive scientific knowledge, we have seen that we have a shifting of this traditional model towards the dominance of biopsychological model, or rather biopsychosocial model, which says that yes, if there is any pathogen, if there is any hazardous chemical, hazardous material, that definitely will lead to pathology or illness. But there is predominance of psychosocial factors, which do include the attitude, the behavioral manifestation, quality of lifestyle, etc., and that help us to attribute ourselves as a person, which is a person in terms of a psychosocial or a psychological entity rather than a diseased entity. So if we want to cure ourselves, it is through the psychological perspective, it is through some biopsychosocial attributes we can cure ourselves rather than the basic etiologies of the disease. Now, most of us have a confusion. We always feel blue, we have sadness in our mind, we are always in gloomy state. We say that we are feeling depressed. Many of the students, many of us faculties, many of the normal people, they always suffer, they say that they suffer from depression, they feel depressed. But having depression or feeling depression is different. When we say that we are depressed, in order to qualify yourself as a clinically depressed person. Remember, in order to qualify yourself as clinically depressed person, you should have two basic characteristic features. What are they? You should have persistent sad mood or excessive unhappiness. In scientific term, we say it's dysphoria. Like when we have excessive happiness, we call it euphoria. And when we have excessive unhappiness, it's dysphoria. Together with it, we should have anhedonia. These are the two important cardinal symptoms of clinical depression. But remember, what is anhedonia? First of all, anhedonia means loss of interest or lack of interest in anything. So that is a classical sign of depression. But please do remember, if it happens for a single day, if it happens for a few hours, it's not a clinical depression. The clinical depression should linger for at least 2 weeks, and each symptom should be present at sufficient severity for most of every day. And how we mean by severity of disorder? It's determined by both the number as well as the severity of symptoms and the degree of what we call as functional impairment. As you can see in the picture, I have used one quotation here. Real depression happens when you stop loving the things you love. So it's very important to indulge in the things we love. So depression, rather clinical depression or scientifically clinical depression, is actually considered a clinically heterogeneous disorder, a constellation of symptoms. You can see from the picture itself, it's an aggregation of emotional, physical, and cognitive perspective. When we talk about the emotional things, see, it's sadness, anxiety, irritability, lack of enjoyment, hopelessness, the feeling of guilt. The cognitive perspectives include the lack of concentration, lack of attention in your work you love or you do not love, the short-term memory, long-term memory. You lack the judgment of taking the proper decision. You lack your mental alertness, mental sharpness. Your thought processes may be a bit slowed down. And considering the physiological symptoms or physical attributes, it's tiredness. So it's not only physical tiredness, combined with it comes the mental tiredness. So headache, stomach problems, irritable disorder, pain, psychomotor agitation, insomnia. You can have more sleep, hypersomnia, or you can have less sleep, insomnia. You can eat more, hyperphagia. You can eat less, hypophagia. As a result, you can have weight gain or weight loss. You can have even the sexual dysfunctions also as a part of physical disorder. So these are series of clinical symptoms which you may be affected in order to qualify yourself being clinically depressed. Now, coming to the cognitive symptoms which actually have negative impact on various aspects of life. Coming to the cognitive aspects, it can be affecting your work life, it can affect your school life, college life, academic institution life, it can affect your family life, personal life, and definitely your social life. If you are considering your work life or academic life here, it's very important for you to maintain your own performance index, okay? Academic performance index, we say. So if you have loss of focus, if you have a loss of productivity, you can't concentrate on what you want to do, then obviously it's a type of cognitive burden on your head. So these things do come as a part of negative things in case of cognitive disorder. On the other hand, if we have the family or personal life intervention problems, that means we can have problem with experience of household problems, financial constraints, because we know in this pandemic situation, many people have lost their jobs. They could have the financial constraints also. So these are also making them prone to depression. We need to struggle with a variety of attention-related tasks, be it any academic work, be it your household core. You need to focus, you need to have concentration, but you're not able to participate in those tasks. You are unable to participate fully in a family life, wholeheartedly. Coming to the social life, since we know that we are having a particular ambience, which is becoming shortened and shortened within the four walls of a room. So you can exhibit social irritability. That means even if the pandemic goes out, you can feel a social inhibition. You cannot intermix with the people because you are now making yourself habituated. So this can lead to depression. So about the cognitive symptom of social life-based depression, you can have social irritability, you can have problems of meeting the expectation from the society, from your friends, from your families, and obviously you will make yourself difficult to intermingle with the people in your social life. So those are the cognitive symptoms of depression, which can have an important impact in your day-to-day life. It's very interesting when in this situation, when the criteria of depression, that means the people who are prone to depression or the database of the depressed workers were taken into consideration, though the data is emphasized with respect to the Western world papers, presentism is actually considered as a fact that presentism is considered to be a more greater problem compared to absenteeism. When you're not in your workplace, you're absent from your workplace, it's okay. It's your own problem. But when you're present, we in our classes we always mention that be alert when you are in class. Okay, don't be just physically present, be also mentally present. So presentism means reduced productivity when people are still at work. That is actually acting as a problem with respect to the depression. So a depressed person, a depressed worker, even if he or she is present, that can have a negative impact in terms of the work performance. And that is obviously acting on the financial constant with respect to a company, with respect to the academic institution, with respect to any institution in question. Now, what's the likelihood of the final outcome of depression? Now, there are various factors, known factors, unknown factors. Of the known factors which are there, which make us prone to depression, there are a number of factors like genetic and family predisposition. Like the family history, if there are cases of family history-based depression records, then a person may be prone, much more prone to family depression, family history-based depression. A person can have a psychological vulnerability compared with the other one. These things do happen even in a family or even after a particular person gets into another environment. That's why we say nowadays that it's not only a genetic factor which matters, but it's gene-environment interaction that matters. Another interesting fact that has been coming out in terms of depression, the people who have got O blood group, the people who have got O blood group compared to the other blood groups, they are much more susceptible to depression. So it's a warning bell for those who are having O blood group. Now, another factor, individual coping style. You have seen that many people are within the midst of stressors, because stressor or the stress is a part of life. Some people cannot cope with it, some people can cope with it. Like if you have a recent bereavement in your family, if you have a sudden death in your family, if you have any type of life-altering loss, recent breakup from your close relationship, from a close friendship, so then you can have a depression. You can have depression if you have a concurrent medical illness, which can be life-threatening ones, which means a chronic physical illness. It can be cancer. It can be a particular illness like irritable bowel syndrome also, which will be actually affecting yourself in your day-to-day life, day-to-day work-life performance. Another factor, nature of treatment, which we call also as drug-induced depression. Now you can have a series of unpleasant or demanding treatment. It can be costly treatment, which can have again a financial constraint. It can be a treatment which can have lots of physical side effects. Physical side effects, I emphasize upon that. So because physical side effect means you can have a physical body-based signs and symptoms which come again as a part of treatment, a mandatory treatment, like in many cancer, chemotherapeutic use. You can have, again, problem with antihypertensive or corticosteroid medicine-based utilities also. That can also lead to depression. You can have low social support. Adverse social circumstances can be of various reasons. And finally, last not the least, is different types of substance misuse, addiction, the number of drugs which we know. So these are the factors which can have a inclination towards the depression, clinical depression. Now, so depression comes with different flavors, different factors, different tunes, different reasons are there. Like if we have a clear scientific triggering life effect, we say it's a reactive depression. If the depression comes in terms of physical manifestation, physiological manifestation, it's simply called somatization syndrome. Soma meaning body. Complication of physical illness. If the physical illness was there and now the mind and body being integrated factor, after the mind is there, if the body is having a disease, then ultimately it comes to the mind, and then you can have the mind and body disorder, and therefore much more complication of physical illness. It comes as a secondary depression. Some depression has no triggering cause. We don't know what are actually the triggers. Then it is said to be an innate or inbuilt depression or endogenous depression. So it's very interesting to find out that when I consider the major depression here, then it's actually the clinical depression or the major depression or the major depressive disorder, MDD, which we say. But there are various types of other disorders, like general anxiety disorder. We can have other disorders which do come to the initial categorization of the MDD. And here, as you can see in the picture, we have about subsets of lots of elements which come both in the cases of MDD and the anxiety disorder. So major depression can have a series of signs and symptoms pertaining to anxiety disorders. We can have in our home front, in our house, in our academic front, mild short-lived reactive episodes. That is an adjustment disorder, and we can maintain with our day-to-day activities. We can get rid of these adjustment disorders, and if these adjustment disorders are there, then you should not panic, because this does not come under the normal depression. There is another thing called dysthymia, persistent lifelong depressive disorder. We often call it as smiling or chronic depression. Why, because I have told you that in order to clarify or maintain that clinical depressive phase, you have to have a 2-week duration phase of depression. So if it is more than 2 years, you cannot call it a sort of MDD, but it's called dysthymia. So you can have that. It's not a severe thing. It's a chronic thing. And you can have that all throughout your life. And you can do all your work. So dysthymia can also be there. So do not get confused between dysthymia and depression. That means clinical depression. There is another term called seasonal affective disorder. Seasonal affective disorder is when we say that in case of certain times of the season, times of the year, that means at the end season, we have the depression symptoms being ensuing upon us. So that actually is in a cyclic phase. So the disorder being affected by season, so it is called SAD. So we feel sad during that particular time. Most people get depressed in the cold, dark winter in absence of light. So for them, the light therapy or the phototherapy do work. Disruptive mood regulation disorder. A child may be bad-tempered. Most of the time has severe explosive outbursts with the parents, teacher. We see those type of child in our day-to-day life also. So it's better to go for counseling in terms of that, because we often say that the child, if they have showing the outbursts, we actually try to undermine their signs and symptoms. We don't allow the child to be clarified with the term or terminology of depression. But a child can also be clinically depressed. And finally, which does not come within the banner of depression, which I am going to mention, that is the manic depression or bipolar disorder that has got mood swings. So that is not a type of MDD or major clinical depression, which I am going to focus upon. Now, very interesting fact. When I say that you are having a depression, we are having a depression, it's not very easy to qualify yourself in this exam of depression also. We have lots of scientific diagnostic manuals for assessing depression. If you are clarifying yourself to be a part of that depression life or depressive life, then you can be acting as a depressed person. So these are the three manuals which are very important in terms of assessing depression clinically. So there, if you see the three manuals I have written here, mentioned in the table, there are various signs and symptoms. You can see the click arrows are there, which means you should be having those signs and symptoms in order to clarify yourself as clinically depressed. Like you can have depressed mood, anhedonia, the significant weight change, sleeping problems, the psychomotor problems. We can have the feeling worthlessness, cognitive problems, thoughts of death, self-confidence, etc. Now, if you really focus on this particular table, one thing comes as a sure. In ICD-10, that means the classification manual for the mental and behavioral disorder, that ICD-10 manual, you can see all the signs and symptoms are available, but the last, that means self-confidence or self-esteem problems, have been added actually in ICD-10. But the rest of the signs and symptoms are common for DCM-4 and DCM-5. That means the Diagnostic and Statistical Manual of Mental Disorder. So in order to qualify a particular person as a clinically depressed person, you should have these signs and symptoms into clarification. But DCM-5 comes with various symptoms. 9 symptoms are there, of which you should have 5 or more of the following 9 symptoms nearly every day for at least 2 weeks. Please check it out. If you have 5 or more of the following 9 symptoms nearly every day for at least 2 weeks, then only you are succumbing yourself to a MDD, major depressive episode disorder. 1. Depressed mood, irritability, markedly diminished interest or pleasure in activities. Remember, I mentioned about anhedonia. Third, significant weight loss, even without dieting, or gain or increase or decrease in appetite. It's the different cases. You can have weight loss or weight gain. You can have increased appetite or decreased appetite. You can have less sleep or more sleep, insomnia or excessive sleep. Fifth, physically agitated or slowed down. You can have a loss of energy. You can have a feelings of worthlessness, excessive or inappropriate guilt. You can have a diminished ability to think or concentrate. That means you suffer from lack of taking any particular decision, even in a major life-setting goal. You can have, finally, a recurrent thought of death, or we call it suicidal ideation. Coming to the fact that we have a depressed brain, we are having a depression. Again, I have told you, you have to qualify in the exam of depression. It's not so easy to call yourself a depressed person. Remember, everything has pros and cons. So when we say that the rating scales are there for depression, please do not concentrate on the different types of small colored boxes here, because you will be getting depressed if you see on all of them. Okay, so I would just like to mention the fact, emphasize on the fact that there are a number of rating scales for depression, clinical depression, of which I will be picking up only one scale for you to understand. What's that? I'm picking only a scale from this, which is called Montgomery-Åsberg Depression Rating Scale, or MADRS scale. It's a validated scale to assess severity of depressive symptoms. As you can see, the scale actually shows you the 10 symptoms of depression. 10 symptoms, what are they? Apparent sadness, reported sadness, inner tension, reduced sleep, reduced appetite, concentration difficulties, lassitude, lack of energy, inability to feel, pessimistic thoughts, negative thoughts, and obviously suicidal attempt-based thoughts. Now, the interesting fact is that there are 10 symptoms here, okay? But the total score of depression ranges from 0 to 60. That means no depression feature, that means you are normal, and 60, which is the maximum score. So you should not be happy if you are having the maximum score here. Now, when I say 60, each and every type of symptom is given 2 marks. So totally, it's 10 into 2. So totally every time we are multiplying the symptoms, 10 symptoms, we are getting, each is given 2 score. So as a result, even if you have the at least 6 of it, as I mentioned before also, 5 or more. So even if you have 6 of all the 10 symptoms, you will be getting the score as ultimately having an attribute of depression. So sub-threshold depressive symptoms is less than 5. If you have a mild depression, that means the score will be 7 to 19. The moderate depression, the score range is 20 to 34, and the severe depression, obviously, we should not be able to qualify ourselves. We should not be able to qualify ourselves, rather, MADR score, which ranges from 35 to 60. So these are the different types of rating scales which are important here. Now, whenever we say that the scales of depression, the cycle of depression is actually having, hello?
Yes, ma'am.
My slides are visible, right?
Yes, ma'am.
Slides are visible.
Okay. Okay. Now, as I suggest, to clarify yourself to be a clinically depressed person, what are the criteria? You should also be going through the process of cycle of depression. Like, if you have a cycle of depression, then you should have the continuity of the cycle. That means the cycle should go on continuously until your inner worriness stops and your inner unconscious dreaming effect is also normalized. It is said that when your innate needs are not being met, obviously we'll start to worry about those things, logical or illogical things. Then obviously you will get emotionally aroused. Your thinking power will become catastrophic. We call it all or nothing. Then your patterns of expectation should not be completed within that particular environment you are thrown in. And then that even if you have sleep, within the sleep you can have those thought processes moving out, and you have intense prolonged dreaming every night, and as a result your sleep process will get disturbed. So next day when you will be waking up, you will feel exhausted, lacking in motivation. So innate needs not being met. So as the innate beings, you are not having any solution to the problems of those thought processes which you have inside your deep-seated brain. Obviously, your cycle will continue. And that's the mystery of cycle of depression. Now, let me come to the very important fact, which is called suicidal ideation. I've told you this is one of the last but not the least symptoms of clinical depression. Beck's cognitive triad of depression, rather Beck's negative cognitive triad of depression. It includes 3 important attributes. What are they? Hopelessness, helplessness, worthlessness. You can consider yourself, or rather you can visualize yourself as the particular, within that triangle. As you can see that you are surrounded by the negativities, the negative cognition. What is that? Negative views about yourself, negative views about the world around you, negative views about the future. You don't know. So the devaluation of self, world, and future. That's the interesting aspect of cognitive triad of depression. And if those things do stay in your head, then untreated depression can get worse, worse, and worse, and giving rise to what is known as suicidal attempt or suicidal ideation. Now, some data which we have known about suicide. Close to 8 lakh people die due to suicide every year. Every 40 seconds, someone in the world is dying due to suicide. And a very interesting fact is that it's not that always a person dies in the first attempt. Almost 50% of the people fail in the first attempt, and the second time, obviously, he or she becomes successful. So a prior suicide attempt is the single most important risk factor for suicide in general population. 79% of global suicide cases do occur in the low and middle income countries like us. Now, of all the different types of aspects, the gender aspect also comes as an emphasizing point here. The males and females both obviously commit suicide, but the probability of the males committing suicide is more common in the older phase of life. But in case of female, mostly common in the middle age of life. Now, one of the reasons for it in case of female is that they suffer from marital related problems, and they are much more prone to this depression and resulting in the suicide, because most of the time it remains as untreated phase of life. Now, Let's come to some scientific aspect. I know you won't be loving to go into the details of the scientific aspect, but depression is a scientific disorder. So I'm not considering all the different parts of the brain, but let us focus very briefly and lucidly to the main system of emotion. We call it cortico-limbic system. I repeat, it's called cortico-limbic system, which means the cortical part, the cerebral cortex part, and the limbic part, the limbic system, which includes all the different areas and the sub areas pertaining to emotion. Now, of different areas, I have here focused on 4 different areas. If you can see in the slide here, on the one hand, we have the dorsolateral prefrontal cortex. We call it PFC. Now, prefrontal cortex is a small part of the frontal lobe of our brain, which is the executive sector. That means any type of important decision, important thought processes, important logical or reasoning-based activities, the motivating skills are all attributed to this part. So this is an executive genius part. The anterior cingulate cortex can selectively from the different types of criteria, it can selectively select different types of aspects from that. For example, it can select the positivities, it can select the negativity. That means it can have a negative affecting part also in terms of limbic system manipulation. It also governs the different types of social interventions or interactions we can have. Finally, coming to the part or deeply engrossed part of the amygdala and hippocampus being a part of limbic system. Amygdala is considered as a very important bell at the level of emotional stress and learning. Amygdala is a very important organ when we consider in terms of fear stimuli, if we consider in terms of anxiety stimuli, if we consider in terms of a pleasurable learning stimuli. So amygdala is a very important emotional controlling center. And hippocampus is a hallmark of depressive symptom, because hippocampus help to convert the short-term memory to long-term, and our life is based out upon the successful venturing of the long-term memory-based activities. So that's the clarification of corticolimbic system. Now this is under the normal scenario. What happens in case of depression? Now scientifically, it can have a very strong terminology of regarding the neuronal tract. It's called limbic, cortical, striatal, pallidal, thalamic tract. So it is the key neuroanatomical tract in depression. So very lucidly, let me make it simple. Depression shrinks your brain. If we have here mentioned about 1, 2, 3, 4, 5, 6 different subregions, we have already talked about the prefrontal cortex, the anterior cingulate cortex, amygdala, and hippocampus. 2 other areas which I really want to mention here. Insular cortex is also another part of the cerebral cortex, which is very much important in terms of motivation, attention, etc. And the nucleus accumbens is also very important because it is considered as recognition site for rewards. It's a reward center. So if you want a reward, if you have a happiness, the happiness does matter in your life, obviously, and your happiness center is rewarded through the nucleus accumbens. The feeling of happiness in terms of reward or reward comes from nucleus accumbens, and you can see that in case of clinical depression, you can have hyperactive amygdala. Remember, amygdala is closely related to fear, anxiety. So if you have the excess of amygdala, then you are becoming utterly depressed. On the other hand, there has been found to be 25% decrease in the gray matter of hippocampus. Scientific data is there in case of depression. So you are having smaller hippocampus. That means your memory loss, long-term memory-based loss is there. Second, decrease activation of all the motivational centers, the executing centers, all the anterior cingulate cortex, insular cortex, prefrontal cortex, decrease activation. Your brain can have cortical thinning in the right hemisphere. Right hemisphere means right cerebral hemisphere. So as a result, there are in between the neurons of your brain, there are some healthy cells, supportive cells, which are called neuroglial cells. Those glial cells are very important important in order to maintain the synaptic plasticity in your brain, in order to make yourself adjustable to the concurrent, adjustable, newly found novel environments. So if you have the loss of glial cells, you can understand, you can have dysregulated connectivity. And as a result, you can fall short of the neuronal signaling pathway related to the normal functioning in your day-to-day life. And finally, I would also like to mention about the pathway which is called Mesolimbic dopamine system. The Mesolimbic dopamine system is actually a type of reward facilitating system. So here, all the good thoughts, all the good processes, good things should be mediated through nucleus accumbens, which I've already mentioned. So there is dampening of that particular system, which means that we are unhappy. So remember, one of the clinical symptom of clinical depression is that we should be having a prolonged unhappiness. Now, one thing is common for all the depression: the neurotransmitter. The word neurotransmitter is known to everyone nowadays. Okay, so neurotransmitters helps to transmit between the different types of neurons with the help of the synapse. And at different points of our body, there are lots of neurotransmitters in the question. In case of brain also, there are number of neurotransmitters which are hyperexpressed or hyperexpressed in terms of depression. Now, there are a number of neurotransmitters whose deficiencies are linked to depression. What are they? Serotonin, dopamine, norepinephrine, GABA, and BDNF. Let's have a look. There are three things which we all must be now knowing: serotonin, norepinephrine, dopamine. Now, these are also the three neurotransmitters which are used as the hallmarks of drug targets for treating of the depression. We call it antidepressant. GABA has a calming effect on the nerve. BDNF, brain-derived neurotropic factor, it helps in the finding out the connections between the brain in the form of brain nutrition. So it's also a very important brain growth factor. On the other hand, we have the excess of neurotransmitters which are also implicated in clinical depression: acetylcholine, substance P, and corticotrophin releasing hormone. Now, please remember, the substance P is not only a neurotransmitter, it's also called a neuromodulator. It has got a number of known and unknown function, and it has also got an immunological perspective. And above all, the hypothalamic pituitary adrenal axis. Remember, hypothalamic is the hypothalamus, pituitary is your pituitary gland, and adrenal axis means the corticosterone, the cortisol, that means your glucocorticoid. That entire axis becomes perturbed in the form of overactivity of each and every set, which means that your dysregulation happens at this axis. So these are the things which are being affected due to depression. Let's come now to the treatment strategies. Now, a physician says that a good physician treats the disease, but the great physician treats the person. William Osler was a famous physician who mentioned this. And we have seen that there are a number of treatments being available. Number one comes psychotherapy, which is very important because it's very essential for us to get rid of our negative thinking. Of the different types of psychotherapeutic approach, the first thing which comes is cognitive behavioral therapy. As we know that it's very important to negate the negativities or the pessimistic views of life, it's through the cognitive behavioral therapy. So it's a type of combo pack of behavioral therapy and cognition-based therapy. IPT, interpersonal psychotherapy. It is actually improving the situation between number of families, between yourself and your friends, that may be within the closed circuit scenario. So it explores the family interrelationship problems, which can trigger the depression. And psychodynamic approach, it's actually which is there already in your mind, insight-oriented therapy, which focuses on some unconscious processes manifested in your present behavior. So some unresolved conflicts of mind may be there, deep-seated, which can arise from your past. Those things should be coming out through psychodynamic therapy, because dynamicity means it's not static. Pharmacological treatments, medications, which includes antidepressants, mood stabilizers, and antipsychotic pills. Now, very interesting fact is that there are a number of treatments which are actually being coming out, like SSRIs, selective serotonin reuptake inhibitors, dual SNRIs, or serotonin and non-epinephrine reuptake inhibitors. So these are at the top of the list of the antidepressants nowadays, having showing list of the side effects. Okay. Now their goal is what? The goal of all the antidepressant is to make stabilize the things which will make us happy, to slow down the reuptake of the neurotransmitters back to their pavilion in order to make us happy. So they are mostly the things which increase the time of availability in the brain. Now, there were some other types of antidepressants like the TCAs and the monoamine oxidase inhibitors also, working in the same principle, but they are not recommended to that aspect because of the number of side effects like dry mouth, constipation, insomnia, etc. Now, recently, FDA has approved another nasal spray-based medication. We call it esketamine or ketamine. Now, that is a non-competitive NMDA glutamate receptor antagonist. Now, what does it do? The particular medication works by kicking up the production of the glutamate, which is actually considered as a major excitatory neurotransmitter that helps the brain to form new neural connection. So if you are making new neural connection, means it is increasing your synaptic plasticity. There are some brain stimulation protocols, like the methodologies are there, like electroconvulsive therapy. We call it shock therapy. We have seen in number of movies the people are giving or getting the shock. This is not as complex as that. It is totally a clinically approved technique performed under the anesthesia. A very small amount of electric shock, electric voltage is being given, and for less than 1 minute under anesthesia, in order to change the number of brain chemicals which will make you happy. So that is a control technique which is there in terms of electroconvulsive therapy. Repetitive transcranial magnetic stimulation, as the name suggests, you are inducing magnetic fields to stimulate the neuronal attributes well within your body, well within your brain, which, remember here, the signals should not be reaching more than 5 to 6 centimeter deep inside your brain, which is the executive center. We call it again dorsolateral prefrontal cortex, which I have mentioned before. And third, which is a very common technique, is also called vagus nerve stimulation technique. Here, a surgical implant is being made, just as a pacemaker you have seen in case of heart. That is simply implanted, sending the electrical pulses to the brain, and as a result, that brief seizures which are being actually be generated, that will help you to make you happy. Rather, it will change the brain chemicals that will allow you to make you happy. So this is actually a technique of brain stimulation. Finally, I would like to come to the slide which I love to propagate rather, and that is called alternative forms of healing. Because medications should be there, medications will be there, but they are all supplemented with the help of lots of other techniques. We call it mind-body medicine. The first and foremost is physical exercise, because it has been scientifically proved that if you have physical exercise, mild physical exercise, the freehand exercise, it will release endorphins. And endorphins are natural mood booster. They are analgesics, pain relievers. They are sedatives. It will help you to be asleep. Regular sleep cycle will be restored. So physical exercise is must. Second, dietary guidelines. Like all the balanced dietary protocol, you should have carbohydrates which are smart carbs, not the simple carbs, the whole grains which I'm mentioning. You should have more on omega-3 fatty acids. You should have lean meat. You should have the folic acid. You should have vitamin C, vitamin E. You have lots of antioxidants. You should have Mediterranean diet-based activity where you have olive oil and less fat and more protein. These are the dietary guidelines. Coming to the yoga, there are lots of yogic techniques which are there, of which Pranayama is the series of activities of awakening your internal energy. We call it prana. And you know, the healing which comes with the prana is also called pranic healing. So it is nothing but it helps you to calm down your nerves and restoring your rhythm to your innate breathing system. Anuloma vilama, which is the alternate nostril breathing. We now are quite aware of these terms nowadays because it calms down our mind and heartbeats are rhythmic. So those are things which are very important. Kapalbhati pranayam, as the name suggests, Kapalbhati, the glow of your forehead. So how will it become? If you are getting yourself rid of the toxins, in the form of carbon dioxide, which is already stored within your body by forceful expiration. So that is the essence of Kapalbhati, because it has got a tranquilizing effect on the brain due to increased oxygenation also. Creative therapy. You can have any productive attributes. You can have music therapy, dance therapy, you can have play therapy, you can also have pet therapy. Many depressed people have the pets. We have seen that if they have pets, they will be becoming undepressed from the depressed. And finally, mindfulness or meditation. Corresponding to it comes the psycho-spiritual intervention, which means the essence of the energy medicine or energy healing. Now, let me talk very briefly about the music therapy, which is the goal of the day in terms of depression. Since I'm mentioning only about depression, I should be clarifying it here. The depression or the music therapy, which is actually nothing but the sound stimulation at the cellular level. Now, we all are aware, this is a simple slide to explain for all the people here who are watching here, that the sound when is made, that sound comes to ear. Ear have got the inner mechanosensory hair cells in the cochlea, and then those signals, the mechanic signals, are converted into electrical signals through the auditory nerve cells, ultimately coming to the brain cells to be interpreted at the level of brain cell. The same sound is also coming through the mechanoreceptors of the skin and reaching the spinal cord, coming to the brain. See, so that sound is nothing but in the form of number of frequency vibrations. So music is made up of several frequencies that create constructive patterns within the brain that can enhance the brain functioning, and that has been proved scientifically. And it has been seen that for the language of the brain, we call the brain waves as the language of the brain, every sound has got its connection of activating the brain in forms of brain wave. That has been seen here, that if you have one standing wave per second, because whenever we have a sound frequency coming at the cellular level, it's in the form of a standing wave at the level of cell, and it is 1 per second means 1 hertz. We are aware of this term. So the delta wave means if we have 1 to 4 cycles per second, or rather hertz, theta, alpha, beta, gamma accordingly. And I have to mention about this because for me, this is a very important and interesting fact, that the continuous chanting of Omkar Dhani, that means Omkar Dhun, as you say, that plays a wonderful attribute in case of depression. It reduces fear, negativity, and assures mind with increasing positive vibes. High-pitched Om recitation, which brings about mind excitation of your prefrontal cortex, motor cortex, with a mild sympathetic tone. So actually what happens, when our own cell which has got a natural frequency, natural vibrational frequency, that becomes distorted due to some ailment, we have to use some external device to make it reprogrammed. And that is the resonance interference pattern, which means that when that particular frequency matches with the natural vibrational frequency, our cells are having the healing effect. And that has been proved with the help of the Omkar chanting. And this is a slide which I always love to show, that is called the Soma energetic study. Just a bit, I'm not going to the details, just see that there are 7 chakras, okay, which are called the energy healing points. Remember, our body is made up of thousands of energy points, but of which these 7 are the major healing points or healing chakras or healing energy centers. And each of the chakra are linked with the neuronal properties, which ultimately are going to the respective glands or the organs under question. From the lower ones to the higher ones, the root, sacral, solar, and heart, the 4 lower chakras are very important in depression. So if we can manage to have the musical therapy with 396 hertz, with 417 hertz, with 528 hertz, with 639 hertz, then our inner chakras, which may be struck due to any type of ailments, that can again become activated, and we will be having a clear-cut, happiness-based life. That means we will be controlling our depression. And we have seen, if you very interesting fact is that you can only take resort not only to some external device, but your own computer, your own laptop, your own mobile phones to find out YouTube videos. Overcome depression by binaural beats music. To ultimate thing is you have to induce the production of the neurotransmitters like serotonin, dopamine, etc., and boosting the endorphins. So these are the different things. Now here, what I just want to mention, here I have mentioned binaural beats. What is that? Now, the scientists often say that when we listen to a sound, okay, as the sound comes inside our body, then we have two ears, right? The right ear and the left ear. Now, it is said that the tones which the right ear receives is somewhat different from that. So, for example, if I receive 200 hertz in right ear and say 210 hertz in the left ear, ultimately the brain will interpret as a single tone, no doubt. But the difference, that means here it is 10 hertz. So that bi means two, different. So when we have the 10 hertz difference, that difference is interpreted as binaural beat or binaural frequency. And if the music is being set with that wave, then our depression will be cured. So these are the number of lists of the healing music which are available in the YouTube. I've only gathered from that only for you. So you can have that here. Number of combinatorial therapies are also being used. And Tibetan bowls, there is a very famous thing that the Tibetan music has a very calming effect on your mind. And Tibetan bowl based songs are also very important in terms of this, okay, healing music. So meditation, you can have an added combination with the mantra, with the chanting, you have meditation, and it has been proved that meditation means your brain becomes more active in the prefrontal cortex, rather left prefrontal cortex. Just to mention, left region of your frontal or left region of your cerebral hemisphere is dedicated to positivity, pleasurable activities. So positive vibes, if you want to have an increased well-being, reduction of anxiety, irritability, meditation. Last but not the least, color therapy. We love colors. I love to use colors in my slides. I love to add colors in my life. You should be also helping yourself to be color therapeutic based, modulation based lifestyle, or rather chromotherapy, because our body is also dependent upon the natural vibration which are based upon brainwave of vibration, because colors do have emotional input in our life, and of the Viggoer we have the 4 colors important in depression. Orange, which symbolizes sun, treat depression by increasing alertness, concentration, and decreasing the feelings of dreadfulness. Blue, you should have, if you want to sleep, you should have a calmness which reduces tension and induces regular sleep cycle. You have to go for blue. Indigo, a better, darker version of blue, which I would say that the same thing, that color has been found to be very important and impactful in terms of depressed people. And violet, which also relaxes your body and mind, because it relaxes all the muscles, that means skeletal-muscular system, and as a result it encourages a soothing behavior in terms of meditation. So let me now wrap up. Let us augment our self-love. Let's do whatever we feel look like. Let's give importance to catharsis. I haven't mentioned catharsis today, but catharsis means whatever you have in your mind, you should be making that outside from inside. That means you should have emotional release. That is very important. Stress management, time management, managing everything in yourself is important. And if you cannot, please do not hesitate to seek emotional support from your friends, from your families. But you should pace yourself, set realistic goals, not unrealistic attributes in your life. And you should balance your life with enough of rest and exercise every day. That means sleep properly. It's not about how much time you sleep, it's about the quality sleep which matters in your life, because sleep is the best medicine, which we all know. And above all, focus on the positive vibes, positive aspects of your life, what you have did in your past, what you want to do in your life in future. So in the midst of all the different negative situations which you have, please, there are a number of intangible things which are coming in your head. So those things you should be wiping out with the help of your catharsis. And for that, you should read different types of books at your leisure times. And I have myself studied this type of books for you. And I have actually been helping myself to come out of this depressing situation of the pandemic. And I hope that you all should be coming out of this depressive attitudes, attributes of your life. You should practice mindfulness, meditation, yoga, energy healing, etc., which are scientifically proved. And above all, you should rather than taking medication, you should go for the behavioral therapy or psychotherapy, which is also very important in order to motivate yourself, because motivation and hope in the hopelessness situation is challenging yourself with the good things of your life. And I always mention that this is my last book, which is based upon these things, which mentions how to clarify yourself being a part of this entire globe, the strategies of the survival attributes. Okay, so ultimately, after having all the different types of activities which are going in your head, I have already come up to the last part of my slide with a thank you note. And as I thank here, I must thank again the organizers. I must thank again the ones who have introduced me. I should thank myself to the listeners, to the patient listeners, both depressed and undepressed people. And I hope that my lecture has given a small ray of hope in the midst of the pandemic situation. Thank you. Thank you to all.
Thank you, ma'am. It was really excellent presentation, and many of our participants will be benefited from this. I'm Ritan Roy, Head of the Department of Zoology. There are so many questions in the chat box. So Professor Arijit will read it out some of the questions from there.
Yeah.
Arijit, read out some of the questions.
Yes, of course. Ma'am, the first question is from Momita Banerjee. Could depression be caused by our immune system? Is there any effect of immune system on depression?
It's actually a role reversal, because the neuroinflammation, what we say, inflammatory disease, inflammatory disease is a part of immunological perspective. And the scientists have found, the doctors have seen that usage of anti-inflammatory drugs do wonder in case of depressive people also. So definitely, I would say yes. Inflammation, like a part of the immunity or immune system disbalances are concerned, it can have a role. But remember, if you have a problem with immune system, it comes from inside to outside in terms of physiological manifestations, right? You should be having some signs and symptoms if you have an innate immunological problem. And if you have that signs and symptoms in the form of an ailment or a disease, definitely you are suffering from depression due to that. If there are, it's not, if you have any imbalance of the immunological moieties like the chemokines, the cytokines, cytokines have been found to have a very important role in case of depression. Okay, so yes, immunological imbalances have got its role in depression. Yes.
Thank you, ma'am. There is another question from Sanjeev Das. Can illogical dreaming be considered as one of the signs or symptoms of depression? Illogical dreaming.
The most important thing is that, if you understand it is illogical, it's a good thing for you. The most depressed people do not understand whether the thought processes which are going inside their head are logical or illogical. They cannot actually demarcate between the logic and the illogical concepts, right? If you are aware that you are having some illogical things, you are blessed. You are blessed that you are not a depressed person. So if you know that you are having illogical things in your mind, you should try to come out of that illogical thoughts. But from the clinical perspective, definitely the number of illogical thoughts which are going on is one of the cardinal symptoms for depression. But that is not only the qualifying signs and symptoms of clinical depression, but it is one of the precipitating factors, definitely.
Thank you, ma'am. There is another question. Can any of these therapeutic approach be able to restore the brain shrinkage that was happening during
can you repeat the question once, please?
Yes, of course, ma'am. Can any of these therapeutic approach be able to restore brain shrinkage?
The continuous usage. Now, there is some difference here. Now, when it is I have told you, in the most of the low and the middle income countries, the depressive symptoms are as if intangible. That means the people are not aware that they are depressed. So they, like the usual fever or either other ailments which occur in our day-to-day life, we go to the doctors, we seek for medication. The people have got that social stigma that if we are going to the doctor who are actually treating the depression, we are as if we are being designated as some mad people. Okay, so they do not want to go to the doctors, number one. And number two, even the families do not want them to go to the doctors, thinking that the societal things will come and so and so. And ultimately, if you make yourself motivated to go to the doctors also, after taking the prescription also, your demotivating factors will come to, will not allow you to rest in peace. You will stop using the medications. Actually, the brain stimulation techniques which I mentioned, those are things which are only being given at the end or the terminal end phase, that are not for the mild phases. Okay, for those people for whom the medications do not say influence for a lot, that means they are having severe depression. Remember, the term is severe. So if they're having severe depression and other medications fail, then only they go for the brain stimulation. And yes, if already we have damaged ourselves, if already we have a liver ulcer, so if we have some misalignment in our cellular architecture in our body, it's very difficult to get back to the own level. So if in severe case, it's not the ability that you can go back to your the mild phase or no symptom phase, but yes, we have seen that music therapy, mantra healing based, that have got a power to have an effect on the prefrontal cortex as well as on the hippocampus. It has been proved. So I will take the answer as yes.
Thank you, ma'am. There is a question of mine, of course. Does depression have any effect on critical thinking ability of a person?
Yes.
Problem solving?
Yes, definitely. You can yourself question yourself. You can have a number of phases in your day-to-day life, low mood cycle and high mood cycle. Okay, in a particular day, it's not about depression. It's for every individual. See, in daily life, we have all the low phases and the high phases in our daily cycle. And we always say, in terms of psychology, there is a term called desert phase. You know, in a particular time, you can have a desert phase, which actually, whenever you want to do many things, you have a lot of goals in your mind, but you cannot concentrate. So definitely, that is a cognitive load or cognitive impairment you have to face. And functional impairment in terms of cognition, again, is a cardinal symptom of depression. So yes.
Thank you, ma'am. There is another question. Can brain scans show levels of depression?
Levels.
Brain scans, levels of depression.
Yes. Brain scan. See, it depends upon the type of scanning you are using. See, MRI is there, magnetic resonance imaging system. MRI can give you some slices, okay, picture, inner details, okay. But fMRI, the functional MRI, gives you the difference in the oxygen balance, gives you the difference in terms of blood vessels. That means the circulatory phase. They can give you the idea, because whenever we have some functions happening in the brain, you know, the fMRI shows the particular active areas. So we can actually give the huge difference in a normal and a depressed or a distressed brain. So yes, it is really seen in case of any scan like fMRI. Yes.
Thank you, ma'am. There are two questions which are closely related. One is, does menopause has any effect on depression? And there is another question related to it, that depression has any effect on oxytocin secretion.
Okay. Now, as I've mentioned, that it is the HPA axis, hypothalamus, pituitary, adrenal axis, which is the affected axis. And you know, the pituitary, which is called the master gland or the master of the endocrine orchestra, we say it ornamentally. So that actually is related, posterior pituitary releases oxytocin, which it was mentioned. So when the oxytocin is being released, you know, oxytocin has got a very important role in increasing the bond between the people, the lovable bond between the people. So obviously, oxytocin imbalances, if you are depressed, you can have definitely oxytocin imbalance, because you will feel yourself to be lacking in love. You cannot give love, you cannot take love. So as a result, obviously, there is a role, number one. And number two, which you told about the menopause. Now, definitely we all know that after menopause, there are a number of symptoms, signs and symptoms which come naturally. And you know that there are a number of therapy, like called hormone replacement therapy is available, estrogen replacement therapy is available. But currently it is being viewed that it is not only the estrogen replacement therapy which does wonder. You have to assess that together with the psychotherapy also, the cognitive behavioral therapy. So here also cognitive behavioral therapy works wonder. And you know the post-menopause people do undergo the depression, yes, and that depression is a transient depression once they can take the medications as well as the hormone replacement substituted with the other psychotherapeutic approach which I have already mentioned, then a person can again be back to the normalizing life. Yes.
Thank you, ma'am. I would like to transfer now to Professor Ritan Roy for further questions. Professor Ritan Roy.
Sure.
And there are 2 or 3 more questions from YouTube. I'm reading out to you.
Okay.
How depression and overthinking are related to each other?
Very much related, 100% related. It's again a two-way round. Okay, overthinking. Again, I've told you that if you're really clinically depressed person, you will never think that you are overthinking, right? It's that you are, since you're normal and you're behaving as a normal person, you can have a short misadaptive disorder rather. So you are thinking that you are overthinking. Now, if you go on and on thinking about a particular thing again and again, 24/7 for 15 days, remember, then only you are clinically depressed. Yes. If you go on and on with the thinking only for a brief period of time, and again you forget because you have some other productive works to do, then again at the same time when you are again becoming a type of, if you are in an isolated place, or if you are having no work, so no work and no play makes all as a dull people. So as a result, you can have problem with that. So yes, I would again say that yes.
Okay, ma'am. Ma'am, one more question. Any proper diet and food which control depression?
See, dietary interventions, I think I've mentioned very briefly about that. The diet which is good for maintaining your healthy lifestyle is also the same thing. I have mentioned specifically that please take a lots of antioxidant, because antioxidant means since whenever we are stressed out, we are actually having oxidative stress at the level of cell. Okay, lots of free radicals are coming in, and those free radicals are actually affecting your lipid plasma membrane. So as a result, that as your plasma membrane means your cellular architecture is becoming distorted, it's quite natural that the depression will be hampering your cell membrane cells, different types of cells, and especially the brain. And the antioxidants, if you take, there are some innate antioxidants also, but obviously if you have too much of oxidative stress, you have to fight against those vagaries of your internal body nature. Then you have to just go on and fight with the help of some exogenous dietary intervention. Folate, vitamin C, vitamin E. We know that nowadays the media are coming up with these things, right? Eat lots of vitamin C and vitamin E, and also vitamin D. So it's better to eat all the vitamins. That is fruits and vegetables. Keep this as very simple. Eat lots of fruits and vegetables, whole grains, and smart carbs. Smart carbs means not all those the ice creams, cookies, chocolates. Okay, you can have dark chocolates, which boost your endorphins, boosts the serotonin and dopamine. And antioxidant is the key to survival, I can say, and less fat and more protein.
One more question. How can one determine if an illness is causing depression or depression is causing an illness?
See, again, the same way I would like to answer. If you are depressed, feeling depression and having depression, having sadness. So it's quite natural that, old age, this term depression is coming as a very important ornamental term nowadays. The students are coming up with the term depression. See, if you can remember, the teachers, the faculties, even the normal people, just think of your own child who are in the, say, 40s or 50s. Did you remember yourself complaining to your parents or complaining to your teachers of getting depressed? We did have lots of problems in our life. We did have lots of thought processes which were so-called suicidal in nature, but we never succumbed to that because our environment were positive. We actually used to have adjustment. We could adjust our mind. So that's the important way of arising our mindfulness. It was possible, maybe due to the parental help, maybe due to the societal help. So maybe due to the teacher's help. I can see Shima auntie now. She is my childhood mentor. I respect her a lot. She's there. She's listening to me. She's an English faculty, but she's listening just for the sake of myself. So she is an example that I got so many stimuli, positive vibes from her. Till I'm getting that. Okay. Thank you, ma'am. And thank you, auntie, rather. We used to say auntie during those times. Now, so depression, if you are having the problem of depression, I told you, just go through the guidelines, which is in the DSM manual. And please, for yourself, you can, rather not yourself, but you can go to your friend and tell her or him that, see, check, this is a checklist, whether I am getting depressed or not. And even if your friend herself is a depressed person, you should not rely on her output. Please go to a doctor or a psychotherapist in order to qualify yourself towards a proper depression. Because I have mentioned this, that it's very difficult to qualify in the exam of a MDD or a clinical depression patient. Okay.
Ma'am, this is a personal question and this will cover many other questions people are asking.
Yes, please.
And you have already nearly answered it. That is after, in recent events, that is after the death of Sushant Singh Rajput, everyone is putting status in various social medias that if you are depressed and if you need help, you can talk to me and all kind of stuff. Is that really helpful or is that actually harmful? Because if it is a medical condition, we should go to a doctor, right?
Yes. Okay. Just to add to your yes, what you have mentioned, you have already answered. See, antidepressants are actually medications. So if you suppose, if you have a stomach ailment, if you have a problem with your stomach, okay, you go to the doctor and a doctor prescribes some antibiotic. An antibiotic, we all know, has its own dose, right? Say 5-day, 3-day, even for your fever, viral fever. You should be able to take the dose. If you don't take the dose, definitely you are allowing the bacteria to again be re-affecting yourself, right? So that is also same for depression. Antidepressants are given. Obviously, a doctor is given. The doctor is giving an antidepressant to you with some thought that you will be cured, right? First of all, you should have the belief that you have to be cured due to those medication. The belief is very important because low self-esteem, worthlessness is the main criteria, culprit of depression. Okay. So first, your family or the close ones should help or should have the mental support that you should continue with their antidepressants. You should not suddenly, you are thinking that I am very okay and you should forget your antidepressant and go back. And this is where, we, since I've told you, there is a term called remission. Okay. Remission means the removal of all the type of symptoms. So ultimately, if you don't have the final remission in case of depression, okay, in terms of antidepressant, then definitely if you suddenly stop your medication, you can have a number of changes in your brain chemicals because antidepressants are affecting a lots of neurotransmitters, receptors who are being affected by the neurotransmitters. So if you stop suddenly, even we have seen that the withdrawal effects will be there in your body, okay, and that can also make you prone to suicide. Yes, not about some media personality since you have mentioned. There are some other cases also, but there are a number of unreported cases every day in our day-to-day life. The people are succumbing to the discontinuity of antidepressants. Sorry. So those things should be kept in mind. It should be, the withdrawal effect is a deadly thing which can affect and make you dead. Suicide, rather.
Arijit, you wanted to ask one question?
Ma'am, there is another personal question of mine.
Yes.
Is that you told that depression may lead to memory loss. So
yes.
Does vice versa can occur? Means whether it is a person is suffering from amnesia or a person suffering from short-term memory loss. Does that person get depressed?
See, as a part of the neurodegenerative disorder, there are a number of neurodegenerative disorders, right? Alzheimer's disease, then the Parkinson's disease, which you know, okay. So there is obviously cognitive impairment, of which, as you mentioned, the lack of memory, amnesia, or retrograde amnesia, anterograde amnesia. There are huge lists of amnesia. So those things are again a part of another signs and symptom of another disease, right? So if a person is conscious that he or she is suffering from that neurodegenerative disorder, and that something is actually acting as one of the sign and symptom of that disorder, he's conscious, he or she is conscious, right? So that conscious thought of that this is actually affecting my social life, this is affecting my work in work life performance, my family life performance, my social life performance, obviously that can give rise to disorder, depression. And on the other hand, depression definitely can give rise to problem with memory. That is a long-term storage of memory. We call it hippocampus. But when in case of neurodegenerative disorder, due to some other different kinds of, because memory, you know, memory is not only about the hippocampus. Memory means through learning, relearning, reinforcement. There are different things which are there in a part of a memory circuit. So all these things are becoming imbalanced in case of a different type of disorder, which is not depression. So a person, if he is knowing or consciously that he is suffering, that conscious thought of having those signs and symptoms can make him depressed. Yes.
Thank you, ma'am. I will ask Professor Roy.
I will ask.
Professor Roy.
If
Professor Roy, we can't hear you.
depression can be correlated. Sorry.
Professor Roy, can you repeat? We can't hear you.
Hello, hello.
Yes.
Am I audible? Oh.
Yeah.
Yes, yes.
Audible.
Time is very short. Any type of mania is connected with depression. People many times see the mania of that. So that related with any type of depression.
See, there are a number of things called for example, the obsessive compulsive disorder, like OCDs are there, general anxiety disorders are there. Then, as you mentioned, the manic depressive disorders are there, bipolar disorder is there. They are also in bipolar disorder, we call the term or the particular thing which you mentioned as mania. So maniac disorder is something different. That is a part of bipolar disorder, where you have a maniac depressive phase followed by a high energized level when you do not feel depressed. Again, similarly, you can have the low cycle, which is again a depressed phase. So maniac depressive disorder is totally different from the clinical depression, which I mentioned. But that as if you remember, I showed you a slide where there is an intersection of the number of sets. Okay, so that intersection point of the sets there are there. Okay, so yes, maybe 20% or 30% of the mania are contributed or rather precipitating to the fact of the clinical depression or vice versa, but all are not.
Ma'am, some participants are asking from any suggestion on books about and how to develop it. Can you say some names of any books?
Books, there are lots of books. If you have access to the internet nowadays, you can have lots of books. I personally prefer one book which actually I got from my own college library, and after the lockdown I was unable to give it back, and I'm very happy with that. That is a Psychic Healing of Sylvia Browne. Okay, it's called Psychic Healing, Sylvia Browne. This is number one. Number two, I can go back to my own slide if you want, the slide page. And you can actually go to the PubMed side, okay, the Google book or the PubMed site. You can click on the books where you can go for, say, energy medicine or mindfulness, practicing mindfulness, etc. There is a book, very important book from say Peter Kramer. Okay, Peter Kramer, his book is on